Welcome to Life in Red.
This one is really cool and I think prudent because I know we're talking a little bit early, but when this comes out, we're just about to hit Halloween. And I think it's prudent to this conversation. So I'd like to welcome Lindsay Healey. Thank you so much for joining me.
Thank you for having me. I'm excited to be here.
You are, you're studying, you're in your last doctoral year. So you're going to be Dr. Healey soon. But forensic psychology, I think to a lot of people, you see forensics. So I'm thinking CSI immediately. And then you think psychology. So you think therapists or psychologists, all that type of stuff. What is forensic psychology?
So it's funny you mentioned the CSI thing, because that's a very common question I get. Everyone thinks that I'm out there with like collecting DNA and whatnot. So that's more forensic science. So forensic psychology would be the intersection of essentially mental health and psychology and the law. And that can take many different forms. I do go to Carleton. That's where I'm studying forensic psychology there. And the wealth of different research topics that my colleagues and my fellow students study are really wide. So I have colleagues that study like jury decision making and police psychology, correctional psychology and how mental illness plays into corrections, psychopathy. I have colleagues that study psychopathy. I'm in that lab actually. And then my area of research is more focused on the forensic mental health system. So that is essentially like a wide umbrella term for the intersection between law and mental illness, typically serious mental illness. And it's a huge system that incorporates legal partners such as, crown attorneys and courts and decision making there, all the way to the healthcare system where there's individuals get treated and whatnot. So the whole point of the forensic mental health system is not to be punitive and not punish individuals who've come into contact with the law and who have a mental illness, but to help rehabilitate them and reintegrate them into society. Different concepts I study are like the mental health court. So Ottawa has a mental health court where individuals are diverted from the traditional criminal justice system and sort of given treatment options instead of charges and sent to prison, because we know the prison population is already dealing with an overrepresentation of individuals with mental illness. And typically that kind of consequence does not help solve the underlying problems, right? And there's a lot of reoffending and whatnot. So we treat the mental illness. So I study mental health court and forensic assessment. And the big group of individuals I study are forensic patients. So that's sort of an umbrella term of anyone who has a mental illness and who has come into contact with the law. So some of those individuals are actually individuals who are found not criminally responsible on account of mental disorder. So moving forward, because I'm probably going to talk about that term a lot, I'm just going to say NCR, because that's not criminally responsible, because it's a mouthful.
Right.
So individuals who are NCR are basically the big crux of the population who remain in the forensic mental health system. So they have been involved with a crime. So they committed a crime, but because of a serious mental illness, they were unable to appreciate the nature or quality of the act, or that they didn't know that it was wrong. So that's like the legal definition. So as soon as someone has been found not criminally responsible after different forensic assessments, which are completed by psychologists and psychiatrists, then they enter the forensic mental health system rather than the criminal justice system, where they are treated and where they're overseen by a different body. They're called review boards instead of the criminal justice system, and sort of they remain in the system there until they are rehabilitated and treated for their crime. So that's the big sample that I study. So the NCR population would be the main sample that I study.
Wow. lots to unpack there.
Yeah, sorry, I threw a
No,
whole
that's
bunch at you there.
see, don't say sorry. It's perfect. And there's lots, like I said, lots of stuff to get there. And the reason I bring up Halloween, in this kind of interesting time, because there's so many movies, like, right, like Hollywood loves to associate spree killers, mass murderers, the slasher flicks, like they all associate, like they escape from the institution where they're locked up for mental illness or
Yep.
disorder. And so as a general population, and even me who knows a lot about mental health and illness, our first association really with this subject matter is, Michael Myers, like of the Halloween franchise, right? Like being locked up and then escaping and then going on a murder spree. Like everyone's like, oh my God. So
Yeah.
I imagine, and I will ask that question in a bit, the stigma that just surrounds and the danger and the perception of danger when it comes to, NCR and all that. But before we get there, I'm super interested to know how you got into this, because you don't see a lot of children being like, I want to grow up and study people who weren't deemed criminally responsible for a crime, right? Like that's just
exactly.
sounds like something you more fall into rather than like grow up like dreaming of being. So like, what was the path here?
I sort of had an untraditional path, I guess. I speak to a lot of undergrads at Carleton. Carleton actually has a fantastic forensic psychology program. It's one of the leading ones, one of the few leading programs or only programs in Canada. So it's one of the only undergrad programs, there's a few, that you can actually take 4 years and focus on forensic psychology. So I think a lot of students assumed I went to Carleton and did my undergrad there and then sort of ended up into the graduate program, which a lot of people do. I didn't. I went to Queen's. I took a health studies and biology degree, which had some psychology classes and it had a lot of research classes that helped me. But I would start earlier than that because I was never like really big into, I loved CSI, like a lot of people do. I wasn't big into like the slasher films like you're discussing. So it wasn't really that. I think my I wouldn't call them career, my job opportunities that I had in high school really drew my interest to the population of people who do have mental illness. So my very first job when I was 14, I worked at Rita Regional Center. I'm not sure if you've heard of it in Smith Falls. Yeah. And I was like a little petite 14-year-old and I was working with the individuals there had usually severe cognitive, developmental, and physical disabilities. And so for 2 summers, I worked with these individuals and I really enjoyed working with them. And that sort of led into my next job where I worked at the ODSP office for a couple summers. That's the Ontario Disability Support Program. A lot of individuals on ODSP, which maybe a lot of people don't know, are suffering from mental illness issues that do interfere with their ability to work and whatnot. So that's why they're on this program. So I was exposed to individuals with mental illness through that job too. And then I would say like that interest was always there. And I loved watching documentaries on people who were in prison and whatnot. And then when I first started at Queen's, I didn't know what I wanted to do when I got older. I knew I did love psychology. I liked health and whatnot. So I was like, you know what? Queen's is a great school. It's close to home. I grew up near Brockville, so it's close to home. I'm going to go to Queen's, and they have an awesome health program. So I did that. And in my first year at Queen's, I actually, I don't even know what drew me to do this, but I ended up tutoring an incarcerated individual who was at one of the federal penitentiaries there in Kingston. And that was like, I was 19 and I still didn't know enough about, rehabilitation and whatnot. And I was quite naive. And this individual, he was there on drug charges. He was like 24, I think. And he really opened my eyes because I tutored him. I guess he didn't really need tutoring. He was very intelligent over the course of a year. And part of that process, he asked me to help him apply to university. And my first thought was, not proud to admit this, but I have, because this is how we learn. My first thought was, well, you're in prison. Like, what do you mean you want to go to university? That's not how it works, right?
Mm.
And I had this naive view on like, oh, I don't know if you're going to be accepted. Like, you go to prison, you have a criminal record. Why would I don't know if they're going to accept you. I'm thinking this, right? I'm not saying this out loud. And, there's no reason for me to think that. Like, that's sort of like a societal stigma around individuals who are in prisons. And he ended up getting into university and ended up getting out on early parole. And I don't know where he is now, but I hope that he did get to university, and I hope that he's doing well now. But he really opened my eyes. When he got accepted and stuff, I was just like, wow, I need to like change my way of thinking, because this is like, just because someone offends doesn't mean they don't deserve another chance. They don't deserve to be rehabilitated. And it was like, I don't think he knows how much he changed my outlook on things. So that was really amazing. So I was in my first year at Queen's. So on I go, I'm doing my health degree, and I took an abnormal psychology class in my third year, and they don't call that anymore because that's a stigmatizing term. But essentially it was about mental illness, serious mental illness. And we had a guest lecture, and this gentleman came in, he talked about forensic mental health, sort of like what we're talking about now. He talked about sexual offending, and he talked about what it means to be NCR and the forensic mental health system. And I remember I turned to my friend, I remember where I was sitting in that hall, and I turned to her and I said, oh, I want to be that guy someday. That's so cool. And then I went on with my life, and I forgot about it, because that he was a psychologist and I was in a health degree, and I was happy in my health degree, and on I went. So I applied to do a master in public health in my fourth year. And then coming out of my fourth year, there was a job at the Brockville Mental Health Center, which for those you don't know, so the Royal Ottawa Mental Health Center owns the Brockville Mental Health Center as well. It's a separate campus, and it's a forensic. They have forensic units there. So coming right out of my undergrad, I thought, you know what, this is good. I'll get some research experience for the summer. I'll be a researcher at this forensic hospital, and then I'll move on and do my master in public health next fall. So I went in. I was doing the interview, and the person I was doing the interview with, I looked him up, and I had found that he had done research with my teacher from that abnormal psychology class. I was like, great, this will be an icebreaker to show that I've been looking up his research. So I brought that up. I was like, yeah, like I see you've done research with my prof from Queen's. She taught me abnormal psychology. And he laughed and he said, I think I gave a guest lecture in that class. And like my head just exploded. And I'm like, yeah, I remember you. Anyways, long story short, I ended up absolutely loving that job. I deferred my master of public health. I was like, I want to research. I want to be a forensic researcher. I did research at the Royal. We'll call it the Royal, even though it includes the Brockville site too. So that was in 2014. So I did research under this individual. His name's Dr. Michael Cito, and he is now my PhD supervisor. And someday I'm going to be that guy, which is him, who gave that guest lecture to me back in my undergrad. So it's sort of like a cool story I like to tell. It was definitely like fate, I feel like, brought me here. But essentially, I got that job just for a job because I liked research. And I thought, forensic, this is cool. And within a month, I knew that this is what I wanted to do for a living. And I had only had my undergrad, so that's why I pursued my graduate studies at Carleton. Luckily, it's nearby. One of the best programs in Canada was nearby, and my Michael, who was the forensic research director at the Royal, was adjunct with Carleton, so I took that opportunity to work with him in the academic sense and get my degree. So
Right.
yeah,
It
long
almost,
story, but that's how I got to where I am today.
wow. Yeah, it almost is destiny, isn't it? That
I feel like that. Yeah.
yeah, I love those full circle moments. Like even like listening to you talk, I'm like, is it gonna be hit like the story?
Yeah.
Like, oh no, whoa.
Yeah.
Super interesting. Now, getting back to the subject matter, and like I mentioned, so when it comes to mental illness and mental health, especially mental illness, people who've been diagnosed, right? We have a certain appetite with as a culture, as a society, even as progressive as we're becoming with it. It's like we'll tolerate things like depression, anxiety, maybe OCD, things like that. But then when you get into more severe illnesses, whether it's dissociative identity disorder or BPD or even bipolar, right? Like people were still not really ready to talk about that. Schizophrenia, and there was a ton of stigma that surrounds these illnesses, that individuals who suffer from these illnesses are dangerous. I think a lot of people would think that, if you, especially like something like schizophrenia, which is heavily stigmatized in film and media.
Mm-hmm.
So let's try to dispel some myths, especially when it comes to this term of NCR and mental illness. What are some things that maybe is either told in the general discussion of media and movies that like people seem to believe that you're able to be like, not true, we've studied it, we see it, and like this isn't the case? Is there examples you have of that?
Yeah, for sure. So the media, and whether it's mainstream media or like movies and whatnot, like you're saying, is a huge progresses though that stigmatizing sort of it creates the stigma, and it perpetuates it. That's the word I'm looking for. So essentially, there has been tons of research on this, but there is, after all the research been done, there is no direct causal link between mental illness and violence, or mental illness and offending. There's no scientific link between those two. The rates of violence among people with mental illness and a co-occurring substance use disorder, that's when we see that increased risk of violence come in. That's one thing that has been found in the literature. However, it's important for people to know that violent crimes happen all the time, and most people that commit these violent crimes don't have a mental illness. So like people need to remember that, like we're scared of these people that have a mental illness. What about all the people that commit violent crimes knowingly that don't have a mental illness? So that's something people need to step back and recognize. So there is no direct link. Essentially, when it comes to violence and offending, there's so many factors at play. There's what's going on in the individual's life. There's socioeconomic status. Childhood trauma is a huge contributing factor to future offending and violence. Witnessing violence as a child, and unfortunately, people who do have mental illness as an adult, they're disproportionately more likely to have been exposed to violence as a child, and to have been have experienced abuse as a child. So there's all these co-occurring factors, but you cannot have a diagnosis and say that person is more likely to be violent. That's not, research has not backed that up. In terms of people that have been found NCR, some of those people have been violent, but we only really in media hear about the ones that have been, like, you hear about the people who attack a random stranger violently. Like, have you heard of Vincent Lee? He's the individual that beheaded on the Greyhound bus, right? Like, as soon as I say that, you know exactly who I'm talking about. And that didn't even happen in our own province. That happened in the prairies, like that, those sort of sensationalized media cases, those cases are so rare, yet those are the ones we hear about. I'm sure there's been 100 articles or more written about him. And there's been research looking at the NCR population across Canada, and there's like a lot of most offenses are not violent. I think I had some stats here, but only have my stats here. So only 9% of individuals found NCR had a serious violent crime. Okay, most crimes are like property crime. Most crimes are threats, like uttering threats. So, where I work, I study the population very in their crimes and whatnot. And I think people would think that all these individuals for NCR who are detained in the hospital, they're all murderers. They're all no, like very few. Like sure, there are some. Very few. A lot, like most of the offenses are like property crime, threats, like very low level offenses. And strangers are less than 25% of the victims. And when I say victims, again, it could be a victim of property crime too, or a victim of, it doesn't mean it was a serious event. Most victims are family members and professionals. So like healthcare professionals or police officers and whatnot. And that is if there is even a victim associated with the offense.
I'm sorry to interrupt, but it's just, we're so uneducated as a society on the language, right? Like when you hear victim, I mean, I'm ashamed to admit it, but even I thought like NCR is violent crime. So to know that it's 9%, and that when like a story, like a news article comes out, and so the victim, you're like, oh my gosh, someone was murdered or someone was abused or hurt, right? Like there was no association in my mind till now that it's like a victim is also just, you trespassed on my lawn and I charged you. That's so interesting.
Yeah, exactly. And it's the sensationalized cases that create this fear. And what makes a case sensational is usually typically when there's a stranger involved and when it's unpredictable, unprovoked violence. Like that stuff happens so rarely. And most often these serious offenses that do happen are people who did it knowingly. And that's another thing to remember. Like the whole point of being found NCR is because of your mental illness. The whole definition is you did not understand what you were doing was wrong. You did not. It's typically psychosis involved, sometimes command hallucinations or delusions. But that's the whole point. So we don't, again, it's not their fault. It's just like the cards they were dealt. And that's even worse. And that individuals who are, come into contact with the law and who have a mental illness, they have to deal with this double stigma, we call it. So you have the stigma of having a mental illness, and then you have the stigma of being involved in the criminal justice system, and they have to deal with both. And the crappy thing is they didn't ask for it, right? No one asked to have a mental illness, right? No one asked to be so sick that you harm someone you love. And that's the sad thing. Like a lot of individuals, once they become treated and they get medication that's working, then they have to live with the regret and the guilt of hurting a family member or hurting a stranger or hurting a professional, whoever. If they did hurt someone, they have to live with that. So it's really I'm something I'm really passionate about. And when I give guest lectures and whatnot, I do try to dispel those myths. And it's just there's no research that shows that connection between mental illness and crime or violence, unless there's all these other contributing factors. And it's just the cases we see in the media are like 0.2, I'm making the stat up, it's like 0.00 whatever percent of all the cases. Like if it doesn't matter what offense you had, if you have an offense that a mental illness was involved in and you did not understand what you did was wrong, it doesn't matter if it was murder or if it was uttering threats or mischief. you can still be found NCR. And the sad thing is, once they are treated in secure hospitals, which can be less restrictive than like a prison environment. But most individuals who are detained in a hospital and who are sort of found NCR, they're not given a sentence either. So they could be there indefinitely. So you could have a charge of mischief and you could be stuck in the hospital for the next 20 years. If you're not rehabilitating well, or if your mental illness is difficult to treat and you're still deemed a risk to the public. So yeah, there's research that has shown that crime for crime, individuals that enter the let's call it the forensic mental health system, or if you found NCR, and individuals who enter the prison system, individuals who enter the prison system spend way less time detained than individuals who are found NCR on average. So there is this like mentality of, they're just taking the easy way out, but the research shows that they're not taking the easy way out. They're in fact, I can't imagine living with never knowing when you're going to get out, right?
Yeah, that was going to be the next point I wanted to get on with NCR. I'm going back. I haven't taken a law class since grade 12, so 11 years ago, which is really scary to say. In order to commit a crime, and please correct me if I'm wrong, because I'm going back with the terms, you need the actus reus, which is the action, and the mens rea, which is the knowing of which you are doing the act. So to be not criminally responsible, you're missing that. Did I get that?
You did. That was great. Yeah. You're missing mens rea. Exactly.
So, and like you said, people have the association that's the easy way out. If they commit a crime and they want to claim, and I don't even know if it's a proper legal term, but they again, media, movies, they say like they plead not guilty for reason of insanity. So how easy is it, or how hard is it to get that diagnosis to not be responsible for the crime? Like, is it like, I know you already said, like, if you are found, it's not going to be the easy way, but to even get that diagnosis, like, what do you have to, like, how do you prove that? Because I imagine that could be very sticky and at times controversial, especially with like something, maybe, I know you said violence low, but like if there is like people wanting justice, like it could be really hard, right?
Yeah, sure. So the legal process, essentially, it's very, very uncommon to I think I saw a stat the other day. So only I'm pretty sure in Canada only 2 out of 1,000 cases are people found NCR. And the process is and actually not guilty or an insanity defense is actually, it's a stigmatizing word, but it's actually not super inaccurate, because that's what we called it up until like 1992. It was not guilty by reason of insanity. And I think some places in the US still use that term. So we changed it in 1992 to not criminally responsible on account of mental disorder. So yeah, that's where that comes from. It used to be a legal term. So essentially, what happens is when someone commits an offense, and they're either their Crown or their lawyer or someone involved, and we, especially in bigger cities like in Ottawa, we have there's psychiatrists that are involved in the mental health court process to give, sort of expert opinion right at the beginning of the process as well, and to help out. So what happens basically is if someone is suspected to, you can usually tell their crime, like typically the offenses are, like there's some red flags, right? With the offenses, like it was odd to be doing that. Like, I've read different police reports, like running naked through the street and stealing a car is an odd thing to do. Like a lot of times when there's no really real motive that can be distinguished, or typically if the police are interviewing the person and what they're saying, the reason for the alleged offense is that so-and-so was talking to them and telling them to do it. Like there's different cues that it's like, okay, maybe there was a mental illness that was involved in this offense. There's lots of different cues we can look for that. And what happens then is the courts will mandate that someone gets a typically 30-day minimum. Sometimes it can take 60 days, criminal responsibility assessment. So those are typically done in a secure hospital, though they can be done on an outpatient basis if the person's deemed low enough risk. And then they'll just do intensive, psychiatrists will do like intensive interviews, and they'll have different social work assessments and risk assessments to try to determine at the time of the crime, which is hard because we can't go back in time, right? At the time of the crime, was this person able to meet those requirements for mens rea? So psychiatrists are really well trained on people on like malingering, which is like faking. I don't think that happens as often as people think.
Yeah,
it's
that's what I was going to ask.
very hard to get away with that. Yeah.
Like how easy would it be to pull the old Edward Norton and fake it all out on everybody? Probably not easy at all.
No, I don't think so. And I also don't know if that would be the smartest option for a lot of people, right? Because like I said, like you don't get, some people do who are really deemed low risk and have maybe nonviolent and like not as serious charges. They might get sort of immediate release, but that's really uncommon. Like typically you're under this, it's called a review board that oversees your treatment and rehabilitation. So typically like once you're in, it can take some time to sort of become free again. So it's really not the easy way out, as I've been saying, but no, psychiatrists are trained on malingering, and there's ways to, I'm not sure what they all are, but there's flags that they look for that's, some sort of like textbook. Yeah, I was hearing voices and they told me to do this, but they're also observing them for, typically these assessments are done in the hospital. So they're also observing them for 30 to 60 days, right? So not always, but typically if you were that ill at the time of your crime, which would have been very recent, maybe in the past days or weeks, you're probably not completely better moving forward, right? So you'd have to keep up that ruse for day in and day out. So, and a lot of the times the individuals have a record of already being diagnosed with a serious mental illness in the past. A lot of them have already been seen at different hospitals in the civil psychiatric sort of area, in like the schizophrenia or mood programs. So it's not a perfect science, but they're pretty good at it. And then what happens is that psychiatrists will make their recommendation at the end of the assessment, and then the courts will make that final decision. I know in more high profile cases, I think I'm not sure what the impact of like public opinion are. I know that there are infamous cases, like there was one with, I'm not sure if you heard of Matthew DeGrood. He was I think he was in Calgary, and he was a university student, and he had no criminal history or anything as far as I know. And he went out and he murdered, I think, 4 university students, sort of like out of nowhere. And the families were very, very, very outspoken about, they were not happy that he was found NCR, but he, like, it's the law, right? Like, it's public opinion matters, but it's the law is a law. If someone meets those criteria, that's how it works, right? And they don't just release individuals willy-nilly. It takes a long time. It takes a lot of rehab, and they're followed for a long period of time. Typically, even while they're into the community, they're still being monitored and followed.
Right. How do you determine risk? And again, I don't know if that's outside of your expertise or if you even know, but that's something I'm curious about how you might be able to determine or try to make a judgment on someone's risk factor of either reoffending or becoming violent again. What sorts of things might you look for, questions you might ask, things you're trying to determine in order to make an assessment like that?
So there's a lot of like standardized and validated risk assessment tools that are sort of like statistical. They give a statistical um, likelihood of someone
Mm.
reoffending and being violent. Those are used, those shouldn't be used entirely. Those should be typically the best approach to assessing risk in psychology and in forensic psychology particularly is a structured professional judgment approach. So that is taking like statistical risk factors, but also taking sort of subjective risk into play too. So like research has shown that social support is very good at reducing someone's risk. What is this person's social support? So it's a whole bunch of different factors that you have to take into
Mm.
account. It's funny you ask that, because when someone is found NCR, for them to be free, let's use those words, that it's called, they get an absolute discharge. So an absolute discharge is basically you've been found NCR, you have been deemed to be rehabilitated and no longer a significant risk to the public. So as soon as they're no longer deemed a significant risk to the public, they legally have to be given an absolute discharge. And then when that happens, they're free to go. They can, just like you and I, they're free to leave the country. They're free to do whatever they want. And what is, a lot of people ask, what is a significant risk? What deems significant? And there's actually been
Mm.
like court cases to try to like define significant. And like there was a case, I forget which year, within the past 10 or 15 years, where basically they said significant can't be like a minor annoyance to the population. It's got to be something more serious. How you determine that, it's a case by case basis. You look at, like I said, all those risk factors that have been validated in research to show us that, yeah, if someone has X, Y, and Z factors, they're more likely to reoffend. But that's still not perfect, right? It's not 100% accurate. So typically, so what happens with the NCR population is they're overseen by this review board, and I haven't really explained what that is, but a review board is made up of like mental health and legal professionals. So it's a rotating board of people. It's usually 5 people that include like a psychiatrist, a lawyer, a judge, and then a lay person that has mental health experience. And so these individuals literally take turns being on this board, and they will travel from hospital to hospital around Ontario, and they will review a document about the last year of that individual who is found NCR, how they've been doing. And that document can be lengthy, and it has input from treatment teams, input from psychiatrists, anything bad that they did over the year,
Mm.
whether it's maybe if they were aggressive, or if they weren't participating in treatment, if they're breaking the rules, that's all recorded. If they're doing really well, that's all recorded. And then they, on a yearly basis, this review board, this panel of experts, they make a decision using the input from the psychiatrist and the treatment team, and using the individual who's found NCR. They can ask too for what they want, but typically I don't think their voice is listened to as much as the treatment teams and psychiatrists. But then they determine what that level of risk is and what their next year is going to look like. So people who are NCR, they have varying degrees of detainment and security requirements and privileges. So you can have someone who is literally their disposition. It's almost like a probation order, but for the Ontario Review Board. Well, we call it Ontario. Every province has their own, but it's basically like a legally binding document that says X person must be detained at the Royal Ottawa Mental Health Center. They can go into community with staff. They cannot have weapons. They must give up urine samples as required by the treatment team. So it's like essentially instructions. And every year, those in an ideal world, those that disposition will become less and less restrictive. But sometimes if the individual had like not a great year, if they decompensated, that disposition becomes more restrictive. And it is ultimately that panel of individuals who decides when that person can A, start living in the community, or B, become absolutely discharged. So they are the individuals that have to determine whether someone's a significant risk. And they use all sorts of information from the treatment teams, from risk assessments that have been done, from that person's history. So they have that whole person's history. And if that person had one offense and they're remorseful for that offense, and they've been great in the hospital and they haven't done anything wrong, like typically that's a great sign. And, you know, it's a case by case basis, but these experts also review hundreds of these a year, and they become, it's not always perfect. Sometimes an individual is given more freedoms and they, you know, do something wrong and they have to be brought back into the hospital. But humans are, you can't 100% predict what a human's going to do, right? So I would just say it's a gradual process, and very, very, very rarely is someone given an absolute discharge right from hospital. They're typically transitioned in the community, and then they're monitored in the community until they get there. And it's like a test, right? Like you are in the community, you have some of these freedoms, and you're still, you know, take your meds and you're still not acting aggressively or being violent. Okay, maybe we can work our way to an absolute discharge. So they use all the evidence like that.
Okay. Is there like a certain age that you have to be to meet that criteria? Like, do you have to be an adult, 18 years old, or like do people in the juvenile system also would possibly fall under, you know, an NCR diagnosis? Like, can kids also go through this type of stuff?
I don't think so. I've only ever studied adults, and you have to be an adult. You have to be an adult. I don't know if there's something similar for like children. I want to say no, because I've never heard of it, and I've been studying this for 8 years. But yeah, no, all the individuals that I have ever come across or that are in the hospital are adults. And, you know, a big part of that too is like the onset of serious mental illness, right? Typically for males, it is sort of late teens, early 20s. So that's a big factor as well. Just like to have a mental illness onset that's so serious that you are, committing crimes where you don't understand what's going on. I just think prevalence,
right.
like I don't even know if there would be enough people to sort of address that in children, because I just think that happens more often when they are meeting the adult criteria. But no, I don't, as far as I know, no, there's nothing like that for children. I think if it's a great question though, because like if a youth were to come into contact with the law and have a serious mental illness, they would probably the Royal does have a youth unit that and I know there is also there are forensic sort of like court reports and stuff that are done on youth, but that would just be that wouldn't be in the NCR sort of realm. That would be just sort of other law involvement with mental illness.
Right. Yeah. I mean, that's just, again, the movies making me ask that question, because you think like, again, you go to the slash films or whatever, that a child is displaying like psychopathic tendencies and hurting animals or beginning to become more violent, and then they end up in the psych ward at a hospital.
Yeah.
So I'm like, that's why I was kind of like, I mean, that probably does not even, I mean, I don't know, but probably doesn't happen very often, if at all.
Yeah, well, and then that's another thing, like psychopathy or a personality disorder itself is not enough to be found not criminally responsible, right? Like those individuals, if that's their only issue, they still have the mental capacity to understand what they were doing is right or wrong. So that's the big thing with, and the laws did change in the early 1990s to sort of address that, because I do think there were individuals who were using the defense who didn't have a serious mental illness. They had a serious personality disorder, but today that would not be enough to meet that criteria. Though there are some people that do have, let's say, schizophrenia and also have a personality disorder. That happens a lot. A lot of individuals do have a co-occurring personality disorder, but personality disorder is not enough to make you sort of let you meet that definition.
Right.
That's a sort of separate field. Yeah, a lot of people with psychopathy and stuff, they end up in the traditional criminal justice system.
Right. Yeah, it's just one of those things. And I originally was going to ask the same question about like sex crimes or anything too, right? Especially, or like addiction, not to equate the two, but just sort of this idea that you might not know what you're doing because you're addicted or whatever. But I mean, after you kind of answered how difficult it is to maybe be diagnosed as not criminally responsible, like you pretty much answered the question, where it's like it'd be extremely difficult to prove.
Yeah, and that's a big issue, because like mental illness and substance use are, unfortunately, like very often they are co-occurring, and it is hard. And I've spoken to psychiatrists about this, and it's really hard to tease apart, especially when you're looking backwards at someone's crime. We weren't there. Right. It's hard to know if they were using substances, and if they have a serious mental illness, what was the causal cause?
Right.
What was a sort of contributing factor, I should say. And they have to do their best to look at that person's history. Have they had other incidents maybe where they weren't using substances, but they were also experiencing these symptoms? So it's really like I give props to psychiatrists that have to do these assessments, but they're very good at them. But it is an issue, because like I said earlier, that's where there is no causal link between mental illness and violence. But when you have a co-occurring substance use disorder or substance use issues, that's when that risk becomes elevated. So yeah, a lot of the individuals who are found not criminally responsible, they do have substance use issues that are treated at the same time as their mental illness. And yeah, they a lot of times, unfortunately, they go hand in hand, right? And a lot of times their histories are they're tainted with, like I said, abuse and trauma, and they were just not dealt a great hand for the most part. So
you didn't come on necessarily to talk about you, but I'm going to ask the question. So answer it however you feel comfortable answering. But I'm always curious, as a mental health advocate and sharing so many stories of people's, illness or journeys and that. How does this job, affect your peers and colleagues? Like, is it a difficult job to try to separate from, your own kind of like personal things going on in your life, because you might start to really care about the outcomes, or you might read something. I know you said violent crimes aren't huge, but you might read someone's backstory and be like, oh my God, that's like, is there a lot that you deal with and you take on personally in terms of mental health and stuff, or is it easy to kind of separate the two?
For me personally, I would say I'm pretty good at separating the two. I think that I have no doubts that it would, with colleagues and stuff, I'm sure it impacts people more. It depends on their own disposition. I would say that I'm in a unique role where I'm not treating these individuals. I'm not there working with them, treating them day to day, seeing, things that happen on the unit. I'm sort of like removed, and I do a lot of research with the patients themselves. working on multiple studies right now where I'm in on the units, talking with them, interviewing, but then I'm gone. So luckily I'm not exposed to, and if the unit's not doing well that day, if things are volatile for whatever reason, researchers don't go on because, research is vital and important, but it comes second to clinical care and rehabilitation at that acute moment. So luckily I'm sort of removed from the day-to-day stuff. In terms of, I've read some files that are very like horrible to read. I'm lucky we've had volunteers come help do some research that have had to sort of just after a couple of days be like, I can't do this. It affects me too much. And I'm lucky. I had a great upbringing. I don't have like a history of trauma or anything. So I don't have triggering moments that maybe some other people would have. Another thing I'll say is, some people ask, and it's not really what you asked, but it's related, is some people will say, how do you sit in the same room as someone who's murdered someone? Like, how do you smile at them? How do you be nice to them? And I think that, first of all, like that it's easy to have a quick answer. And I think I haven't worked with the general incarcerated population very much at all. But I think what makes it easier with this population is I know that despite what this person did, again, this is not their fault. That's the whole reason why they're here. And it's like I have some of the kindest, most wonderful people I have interacted with were patients that murdered someone in their past, and they're rehabilitated, they've had that medication and therapy, and it doesn't necessarily define them as a person. And it's very easy to have empathy for this population, and I don't really think about what they've done when I'm interacting with them. It's sad, a lot of them, not a lot, but like a lot of them don't have like great support networks, or sometimes their families disown them. So it's like, to me, I find it easy to show them kindness and compassion, because I know that a lot of the times in the hospital, they're definitely treated well, but like a lot of times in the community, if someone finds out who you are, what you've done, you might not get a job, you might not get an apartment. And I just, I always say this sort of cliche thing, like, you don't punish someone for having cancer, right? Like, oh my God, you had cancer. Oh, we can't hire you. Like, I don't want you living in this apartment. But people with mental illness, that's what they go through every day. Like, there's been occasions where someone has offended, been found NCR, their story was publicized, they're doing great, they've never hurt another fly, they're on medication, and then they go to get a job and someone Googles them, and they join a club and they're doing really well. And it's like, it's really sad, because those are the things that, like, solid employment, good family support, good social support, joining clubs and stuff, that's actually going to heal these individuals more. But they can't contribute to those things or engage in those things if the community doesn't sort of allow them to. So we've had incidents where we had a patient who was involved in club, and it was so fulfilling and it was great. Someone found out who they were and banned them from the club. And it was like the happiest part of that person's week. And so it's, for me, it's, I definitely don't take it home. Like, don't get me wrong. Like, I'm not a cold person. I read some of these files and I do have empathy for people who are victims, and they're not all the good things they do, or sorry, all the things they do are not good. Right. But it's, I understand, like, I couldn't fathom going through what some of these people go through, and living with essentially an incurable mental illness, like a serious incurable mental illness. I just couldn't fathom living with that. And so any time I can treat them like a human or show them empathy is like really rewarding for me too. And like that makes a good researcher as well, right?
Yeah. Yeah. I mean, if you're just totally rude and cruel, you might not get what you need, as for one thing.
Yeah.
But what strikes me about you is, I can almost feel the empathy from you through this screen in this conversation. Like, I'm being filled up with kind of like energy and feelings, and it comes across from you so deeply and genuinely.
Yeah.
And that's so fascinating, that you talking to these people who have been subject to these awful things that may have happened in their life, whatever they may be, has made you grow into this force of empathy and really just this energy about you. So I just find that really interesting and wanted
Thank
to
you.
note that. um I have like kind of two questions, and I don't know if I
Okay.
missed anything, so we'll get there too. But is mental illness the only criteria to have someone be found not criminally responsible? Like, is that the only kind of thing people are looking for? Are there other factors that may lead to that kind of diagnosis? Not
Yeah, no,
diagnosis, but
designation.
yeah,
Sure.
sorry.
Yeah. Yeah, no, that's okay. So yeah, essentially legally, the first part of the legal requirement is you have to have a mental disorder. Um, so, once that's diagnosed, then you go on to finding if they were able to understand the nature of their acts. So,
So
and like
sorry.
that's the, yep.
If someone was like blackout drunk, like that wouldn't count, even though they might not know or be cognitive of what they did.
That's a really fascinating question because that's I think the Supreme Court of Canada is looking at that right now. So
Oh,
that is called automatism.
mm,
So automatism is essentially when there's something out of your control that causes you to do something to offend. So that could be sleepwalking. That's actually been found to a finding of automatism. So it's a very it's not used very often, though it does sort of fit into this conversation. So like the legal definition of automatism is unconscious involuntary behavior such that the person committing the act was not aware of what they were doing. So again, they need to change these words, but insane automatism leads to the NCR diagnosis. Non-insane automatism is something usually that's an external factor. So insane automatism is the internal factor, the mental illness. We know where that goes, NCR, we just talked about that. Non-insane automatism is an external factor. Like I said, sleepwalking, though I guess that's sort of internal, but you get what I mean. Sleepwalking, if someone makes you intoxicated and it wasn't your fault. So if someone drugs you and you commit an act. So what happens with non-insane automatism is you're actually found not guilty and you're acquitted and you move on.
okay.
Recently, so voluntary intoxication. So I get really, really, really drunk and I hurt someone. That was always found to be not a criteria because I'm sure you can understand how problematic that would be.
Mm-hmm.
Just in the last couple years, a couple cases actually challenged that law, and now it's going through the Supreme Court. And the Supreme Court is assessing whether voluntary intoxication can be used as an automatism defense. And I'm really curious on where that's going to go, because that, I'm sure there's going to be nuances with that law, but on the surface, that's basically saying you voluntarily use drugs or alcohol, and if you hurt someone or if you offend, you can be acquitted of the crime. And that is like super problematic, and that opens up a whole bunch of doors. And there was a case last summer, I think. I'm not sure if you heard about this case, but it was an individual in, I think, Calgary, and he used mushrooms. And he was a great student, no criminal history, no mental illness. He used mushrooms, and he started like running down the street naked. He broke into a professor's, I don't even think he knew it was her house, just happened to be a professor at his school, and assaulted her. And he was actually found not guilty, because they were able to prove that, you know, it wasn't like him and all this. And that really, that opened up a can of worms, because that sets precedent in law, right? So it has been tried more and more in the last few years. There has been a couple sexual assault cases where the individual was like blackout drunk, or there's one case, I think the individual roofied themselves. I'm not sure why they would do that. And he assaulted someone, and they tried to use that in the court. So it's being tested more and more. Currently, as it stands, the answer is no, voluntary intoxication cannot be used for the automatism defense. But like I said, stay tuned, because I think it's being challenged right now legally.
Wow, that's one of those legal questions that I don't envy people having to answer, because there's kind of like, on the one hand, you're right, like that opens a whole can of worms I don't think we want to open. But at the other end, it kind of, you know, stigmatizes drug users and people with addiction issue. I mean, those are just one of those no easy answers. And it's like, oh gosh,
Exactly.
that's where I'm glad I work in radio and I'm not in charge of those things. My last kind of question, is there a country who's really good at this? And is there a country really bad? So I'll go off my general knowledge of not very little, but what the media seems to tell me is like America would be really, really bad at this type of rehabilitation, and mental illness, you know, rehabilitation. And then I remember, I can't remember where I watched if it was a documentary or what it was, but the system in Finland, where they don't even go to jail, they live in like kind of group homes that's minimally secured. They seem to be doing really well at it. And then, so is there someone who has a really good handle on this system with the, not like with what you do and rehabilitation, someone who's not very good at it? And where does Canada kind of fall in it?
Yeah, so that's a great question. It's hard to answer, because even within countries themselves, the laws are different. So
Right.
there is, and I was actually just reading a paper on this the other day. The forensic mental health system is so nuanced across the world, and then within countries. So even within Canada, we have a review board across every different province. Though our laws are federal, we have found differences in how provinces sort of operate and how long people spend in the system and whatnot. In the US, that's even more the case. I think it's mostly a state by state basis. And I know there's some states that are maybe more in line with Canada's approach. And I know there's a couple, I think, that recently, don't quote me on this, but I was reading in the last several years, they almost abolished that approach, that you can't really use well, they don't call it NCR, depends on the state, but you couldn't really even use that defense there. And they really, there's not a lot of options for that sort of approach. So I know it's like a state by state basis. Rehabilitation, the mental illness in the prison system is like a huge issue. Depending on the study, it's like upwards of like 80% in some cases. That's not serious mental illness. That would just that would incorporate all mental illness. But in terms of like the best and worst, I take your word for it on the Finland thing. I know there are some European countries, and that's something that that I want to learn more about as I go on to like a postdoc or my future career, is to understand the different countries and the different nuances in their approaches. I know Canada is decent, and it's definitely up there and one of the better approaches for rehabilitation. And in terms of, I know I'm gonna have to look into the Finland thing, because that sounds very interesting. I will say though, like detaining individuals who are found NCR is not always not necessarily a bad thing, right? If they're detained in a secure hospital, it's because they need to be. It's because they've been found to be a risk to society, and we have to balance the needs of the person and the society. So I wouldn't say that having forensic hospitals is a bad thing. I think it's a great thing for the people who need it. I think maybe there could be more of a movement to living in the community and stuff, and we're all doing our best, but there's definitely a need for them. So I'm not sure if other countries don't even have hospitals. I imagine that they have them in some capacity, but yeah, I don't really have, I could say that I know Canada is decent with rehabilitation. That's sort of our approach, even in the prison system. It's the idea is not to be punitive; it's to be sort of rehabilitative. But yeah, in terms of like the country that's doing the best and the worst, I know there's countries that don't really have laws around people with mental illness and commit crimes. I think that I couldn't list the countries off the top of my head, but I know like that's not good, right? Because they just end up in the prison system. But yeah, no, that's something I want to look into more and learn about more, but I don't really have like a cut and dry answer for you. It's a great question though.
I also lied. I have more questions.
Yeah, that's
but
fine.
They just
That's
came
great.
up. Because one of them, and I think this is more of a myth, that you could be diagnosed not criminally responsible for reasons that you have like being falsely put in this situation, right? That like you feel you are completely lucid and sane and have no mental illness, and somehow you are found this way and you get locked up in like a psychiatric hospital. I can't imagine that actually really happens with all the kind of like the monitoring, but I'm pretty sure that's like a movie, and I just want to make sure that like I touch on that and just display
Yeah.
like put that myth away.
Oh yeah, I couldn't imagine a situation where that happens. It's not like the decision's made in a day, right?
Yeah.
Like I said, like these assessments take 30 days minimum, up to 60 days. And I know there's some individuals who think they don't have a mental illness, right? That's like a lot of that's a common thing with people with psychosis is if they're hearing voices or if they're having delusions and stuff, like that's the whole definition of those, is that that person believes it's real. If they knew it wasn't real, then the issue wouldn't be there. So no, I would say that absolutely that wouldn't happen by accident. And if someone were saying like, I'm not ill, like I've seen that all the time. And that's an issue because some individuals really believe they don't have a mental illness, and they really do believe they are the next coming of this, religious figure. And then they don't want that to go away, and meds make that go away. So they stop taking their meds. So that can happen, but no, with all the if anything, I would say the opposite would occur. If someone were to slip through the cracks, is that maybe someone should have been found NCR and wasn't,
Right.
rather than the other way around. But again, like these assessments are very intensive. They take a long time, a lot of resources, and
Yeah. All right. So don't worry, people. It won't happen, even if you see it in the movies.
That's right.
And the last thing there is you mentioned you were kind of doing some studies right now. Are you able to share just maybe one or two of the things that you're really looking into right now and studying?
For sure, yeah. So I'm doing, for my PhD dissertation, I'm looking at coercive bullying among inpatients on these units. So that's like I've defined that as when like inpatients put pressure on other inpatients to do things they don't want to do. Can be something like run an errand for them, or give them their medication. So like we know this happens like in the prison system, but we haven't really assessed whether it happens in the forensic inpatient units. I've seen this sort of thing happen, so I know it does happen. Just trying to understand who is engaging this behavior, what makes someone more vulnerable to the behavior, because we have people living in these units who are quite high functioning, who might have like some antisocial tendencies, and then you have individuals who are also very vulnerable, maybe have a chronic symptoms that are really affecting their ability to sort of day-to-day interact day-to-day. So yeah, I'm just looking at that and hopefully assessing how big of an issue it is, and how what kind of individuals are sort of like engaging in it and vulnerable to it. Also doing research on risk of um, escaping from inpatient facilities. It's very rare, but we're trying to come up with a risk assessment to determine what's the risk of sort of leaving unauthorized. So it's called elopement, which people are like, elopement, like they run off and get married.
Wow,
No, they elopement from a hospital is essentially leaving without authorization. I'm also doing research on the individuals that come into the hospital from our mental health court here in Ottawa, and sort of what they look like and what their trajectory is. And yeah, so that's just some of the things I'm working on. I have my hand in a few different pots, but a lot of the research comes back to that forensic population, whether it's sort of downstream or upstream, but that's the sample I study the most. So
this has been one of those conversations exactly why I started this podcast, because it was so damn interesting. And I learned so much of this thing that we think we know that we really don't know unless you're involved in it. So like, amazing. Thank you so much for sharing your expertise and time. Did I miss anything? Like, is there something that I may not have asked or you didn't get a chance to talk about that people really should know, whether it's about the research or something you just want to reinforce?
Yeah, no, I think we touched on a lot, and I'm happy that you enjoyed the topic, and I love talking about it. Obviously, if I'm studying it every day, I have to enjoy it. But like, my take-home message is always like, after the end of a conversation with someone or the end of like teaching, like I said, I give guest lectures and stuff, is like just like the stigma is huge, and I hope that like a lot of my research in the future will address that. And it's basically comes down to education, and even just throwing stats at people, sort of like make them sort of like shocked, like
That 9%, like where you said it's, but
yeah,
I'm like, wow, I've never like,
exactly. And it's just like that one stat can change your whole view on things,
yep.
right? And like, even after individuals are released from the hospital, when NCR individuals are released from the hospital, research has shown that over the next 3 years, only 17% of them will reoffend, and only 0.6% of those offenses are serious and violent. And the traditional criminal justice system, so individuals that come from the correction facilities, 34% of those individuals reoffend. Wow. And like, I get it, and it's the media, and it's whatever, but like, I don't like, we don't need to be scared of individuals with mental illness. Like, look at the people without who are making these decisions with a sound mind, which is not always the case, but it's there's no sort of research basis behind it, and it does happen, but it happens so rarely. And just sort of educate yourself would be there's like a lot of great resources online. If you type in like NCR myths, there are tons of articles that sort of dispel these myths that I talked about. And yeah, just give them a chance. And I'll say there was two fantastic documentaries, I'm not sure if you've seen them, filmed at the Brockville Mental Health Center. So again, that's a campus of the Royal. And they're both available online for free. One's called Out of Sight, Out of Mind, and the other one's called Not Criminally Responsible. And they basically follow the life of different individuals who are in the hospital and being discharged, and sort of put some faces to some people that maybe deserve some empathy, and maybe give people a better take. So I always tell my friends and family to watch those, and they're like, what do you do? And I'm like, these are the people that I study, and this is what the hospital looks like. And these are, not, you shouldn't be scared of, not everyone's scary. So those are two documentaries that people could watch for free online if they wanted more insight and information.
If I'm not mistaken, I feel like Not Criminally Responsible is on Amazon Prime, or or maybe Netflix. I'm almost positive I've seen it somewhere there.
I think they might be both on Amazon Prime.
All right.
But I
Well,
don't quote me on that because
yeah.
they come and go. But I know that last time I checked, they were both online for free. Like you can stream them for free. Yeah.
I'm not sure if you're active publishing on a website or Twitter with this information, or you Instagram a lot, but this is your chance to plug whatever you want to plug, whether it's personal stuff or other things. But please, where can people find you if they need to?
Yeah, so I'm on Twitter. Gosh, I have to look up my Twitter handle. My Twitter is more would be like more of a networking academic Twitter. So it's just my name. So it's at Healey Lindsay. So yeah, everything I do have on there is in my field. It's usually mental health related, forensic related. I have to admit, I'm not a huge tweeter. I would like to be more involved, but I do retweet different things, and I follow a lot of great researchers in the area. And if anything new and interesting comes out in terms of research, or for example, with that, that upcoming Supreme Court decision, like I would definitely be engaged. I would be engaged with those sort of things online. But yeah, no. Yeah, that's that. I once I graduate, and I'm so busy with school and everything too, it's hard to keep up with the social media, but
Yeah.
I hope that someday I can be more involved with that too. But yeah, I'm on there a little bit.
Yeah. No, I mean, I didn't ever try to get my PhD, but I could only imagine. But I would love, and when I speak to other, researchers and everything, like finding ways that we have this science accessible, especially for mental illness, whether
Yeah.
it's social media, podcasts, YouTube channels, TikToks. I just think it's so important and so beneficial. So we're getting our information from people like you who know, and not, people who have a crime podcast or the media, you know what I mean?
Exactly.
Because you can just tell just through this conversation how stigmatizing it can be. So Lindsay,
Absolutely.
thank you. Thank you so much. This was amazing, and I really, really, really appreciate it.
Thank you. It's been a pleasure. I appreciate you letting me get my voice out there.